Hello everyone. And this video is about evidence-based medicine, why it really matters, what it really means for you, okay? I'm sure you have heard the term evidence-based medicine used by hospitals, insurance companies, and doctors everywhere. What does it really mean? And how is it different from the way medicine used to be practiced? And is it actually making healthcare better or just another buzzword um, for denying care, making it difficult for patient to get whatever they need as per their primary care doctor or a specialist? So let's break this down clearly with all real life examples, right? What was medicine like before evidence based medicine? For most of modern history, medicine was based on authority and experience. Doctors relied on what they learned from their mentors, what seemed to work in their own patients, or what tradition said was right. So there were few controlled studies. For example, doctors prescribed antibiotics for viral cold or bed rest for back pain simply because that's what they had always done. This was called eminence based medicine, decision guided by expert opinions rather than solid data. So, what is evidence based medicine? EBM. Evidence based medicine means combining three things: the best available scientific evidence from clinical trials and meta analysis, the doctor's own clinical expertise, and the patient's preference and values. So it's not just reading research papers, it's about applying proven data driven intervention that truly improves outcome. I'm going to give you some examples of evidence based medicine. Statins for people with high LDL or prior heart attack, proven to reduce heart disease death. So that's why it's highly recommended. Blood pressure control below target levels. It reduces stroke, heart failure, kidney failure risk. Antibiotic stewardship. Avoiding antibiotics for viral infection like common cold and flu. Aspirin for prevention. Now limited to only certain high risk groups after new trials showed bleeding risk. Before, aspirin was used quite often by people, but from doctor's perspective, it's really limited now because of the high risk of bleeding. So benefit and harm uh, were compared, and it was realized that the common practice of using aspirin for a lot of disease conditions were not right. Colorectal cancer screening, colonoscopy or FIT testing reduce death from colon cancer. CPAP for sleep apnea improves blood pressure, glucose control, and daytime sleepiness. Vaccinations, measles, flu, COVID, HPV, all proven by randomized study to prevent disease. But that's not happening now in America. America is going backward completely. Lots of things have been called into question, and access are being denied now. So that's different story. When the politics start interfering with the medical science, then it's a different result. I think people lose. That's what happens. People become a loser. I mean, I just read this article this morning in Humboldt County in California, Northern California. Lots of people there want to get COVID vaccine, and they just can't have it because it's not available. It's not like, oh, it's available, you can decide if you want it or not. It's not being made available. Now, lifestyle and diet intervention for diabetes. Diabetes prevention study, showed that 58% of reduction in type 2 diabetes onset. Clot busting drugs like TPA for stroke saves brain tissue if given within 3 to 4 hours. Smoking cessation therapy, nicotine replacement, medications like Vernicline in the double in the study, double control trial shows high quitting rates. I mean, there are so many other things as well, but I just wanted to give some example. So all of them became standard care because data showed they work better than just the older habit or somebody's or doctor just feeling based on their experience that something was good or better because that's how they felt. So it becomes more objective rather than subjective decision. So how this changed healthcare? Evidence-based medicine transformed how hospital, doctors, and insurance companies make decisions. Everybody looking at the same guideline criteria based on evidence. Treatment guidelines from different organizations like American Heart Association or ADA guideline came directly from systemic evidence reviews. Insurance plan often approve or deny treatment based on the evidence strength. It is meant to standardize care, reduce unnecessary procedures, and focus resources where they truly help. But there are lots of cases where this kind of study do not apply because sometimes cases are unique and very complicated. Is it really this evidence-based medicine? Is this really helping or just a trend? The truth is, the evidence-based medicine has saved lives and money, but it's not perfect. It does prevent wasteful care, but sometimes insurers they misuse it to deny individualized treatment. New evidence keeps evolving, and what's the best practice today may change tomorrow. So even EVM in the fashion is evolving process to keep medicine scientific, transparent, and accountable. There are things which used to be recommended 10 years ago, 15 years ago, but they're not recommended now. So when it's applied wisely, balancing research with the patient's individuality, evidence-based medicine is the most reliable way to ensure that treatment actually work in the real world. So next time a doctor says this is evidence-based, it means that your care is grounded in real science, not just opinion. And I most of the time use evidence-based medicine because it came into existence about, I started practice about 30 years ago. So evidence-based medicine was already there, and that's how lots of things just taught in our training program. Even after different board testing, all the questions are evidence-based. So you have to study them, and when you study them, you practice them, and that becomes part of what you do every day. So I just wanted to, bring this video for you guys so that you see these are the important aspect of medical care. And I think that you would want to know what is evidence-based medicine, what is medical necessity, because sooner or later you're going to have to know, you're going to have to face these terms, and it has direct implication. And many times patients, they don't want evidence-based treatment, they want something different. Make a documentation, Some people don't want mammogram, they want thermography or totally different kind of stuff, which is inferior in terms of sensitivity to detect breast cancer. But we ended up ordering it despite knowing that is not supported by evidence base. But anyway, I wanted to have this video for you guys. So I hope you enjoy, and thank you for watching. Have a great Monday.